Good afternoon, all. Please, can we sit down? Please sit down. Can we sit down, please? All right, thank you. So, where did we stop in our last class? So, I don't forget it. Where did we stop in our last class? Rules of what? Okay. So yesterday, we discussed the role of father, mothers. No, we did not talk about child, right? So we'll start from the role of the what? Because the child, they also have a role to do what? To play. Three of us, they do. So let's look at the number one is the right to what? Information. Right to what? Information. Right to what? Information. So assessment of what? Assessing what? Age appropriate what? Reproductive education, health, information. I can remember those days. Not those days. They will tell you that parents, if they want to talk to their children, they will say, don't allow, don't allow, don't allow a boy to see your pants. To see your pants. They will not hit the nail. Hit the hammer on the what? The head of the nail. They started making these kids that they will just. By then, unfortunately, they may follow the wrong people, and you start crying. Those things you are biting your teeth or your tongue before telling him or her. The street will tell him or her boldly, and now he may not learn it in a wrong what way. Am I communicating? So they have right to know, so age. That's why we have this age appropriate what information with regard to what their reproductive what education is very what important. Tell them for the dear child when she come of age. Tell the dear child about what she's going to face with respect to her menstrual what cycle. There's nothing wrong with it. Let her prepare her mind towards that, so that when it start happening, she will not feel somehow about it. Am I communicating? Don't allow somebody else outside to teach your child and everything that has to do with what their reproductive what health education is a very wrong thing to do. Don't allow outsiders to teach your children. Bring them close. Teach them these things. Age appropriate information. As they come of age, you tell them what and what. Am I communicating? When it's coming to adolescent age, you bring them close. Hey, come. Tell me, who is your boyfriend? Tell me, who is your girlfriend? Not do you have? Not go straight. Who is? Now, if you say Do you hear? They'll say no. No. Show me who is your boyfriend. That question will throw them off balance. They don't even know where to start from. They'll just open up. You can now sit him or her down, and they explain one or two things they need to know about what relationship, about, because you can never stop them. If you try to do that, sorry, they'll go behind.
Yes.
I want to see him, I want to see her. Whether you are there or you're not there, they will go outside, they will enter one, and they're not hiding it from you. Next thing, they even go to the extent of hiding pregnancy, and even going to abortion, hiding it. You won't even know what's going on. Or even at the point of their death, maybe at a level of complication, you won't even know what's going on until you are told that this is what you are. Am I complicating? So, but this is because you refuse to bring them close and ask important questions. You are not supporting them to be baptized by asking such questions. It's very important to know. Because if you don't, sorry, you tell them about early childhood, early what pregnancy, and what happens in adolescent age. Whatever they feel or they are pushed to do is normal to do this. Whatever thought that come to your mind is normal. But what is your reaction, your response to it is what matters. Am I competing? By the time you become their what? Confident. They will tell you everything going on, happening to them. That's when you cannot do what? Direct them properly. But if you stand up as one judge, waiting for them you can never help them. You can never help them. Am I competing? That's one area I don't know what God put in this thing. That is one area that people feel even so somehow to talk about. When it comes to that area. So now, let alone a child or an adolescent. So if you don't cultivate the habit of bringing them close, discussing these things with them, you will not be able to help them. That's the point I'm making. Are we together? So it's very important. So give them all these age appropriate what? Reproductive health education and what? Information. Then protection from what? Harm. Yes. Protection from what? Harm. Safeguarding against what? Child what? Marriage. Another harmful what? What is FGM? Who knows? FGM is what? You will go far. You will go far. You will go far. Are we together? So, safeguarding against what? Child marriage, FGM, and other harmful what? Practices. Healthy development. Receiving care and support for physical and what? Emotional and what? Psychological what? Development. Then they are supposed to cooperate in all these areas. Am I communicating? Very important. But cooperation from your child depends on what you give in to them. True of us is what you give them. True of us, yeah. That's depend on how the level of cooperation they give to you to be able to achieve this. Am I communicating? Good. Now the next one is what? The early what? Development. Receiving care and support for physical. Okay, I've talked about that. Then participation and what? Empowerment. Engaging in what? Decision making processes affecting their what? But reproductive health and what? Well-being. Everything is garbage out. All these things I've been talking about the child's participation in their, depending on what you, how. If you keep them there, they remain there. If you bring them close, they will come close. That's how close you will be with their children, so that anything they discuss with anybody anywhere, they will come to you and tell you. If a guy stop them on the way, they will come to you, mommy, you know that Kennedy that lives there. Hey, mommy, He said I should come to his house. So he even bought me biscuit. Oh, because they are free with you. They are free with you. It's very important for the mothers here and fathers here already, and for the mothers to be. Please let us learn this. It's very important for the mothers, for those that are mothers already. If you have made a mistake, please correct it now. Correct it what now. You can never help your child if you don't bring your child close to you. You start from bringing your child close to you. That's the only way you can help. Without that, you cannot help them. Those that are their friends outside will help them. Two of us manage them. Two of us. Hope you're preparing.
No. Not yet ready.
I say preparation. I didn't ask whether you're ready.
Yet.
Okay, you're not even thinking about it at all. It's okay. It's okay. Hello. Is it clear? Good. It should. Now let's look at adolescents reproductive health what services. Are we together? Let's look at adolescent reproductive what health services. Who is an adolescent? Who is an adolescent? If you know it, raise your hand. If you know it, indicate. Anoya.
Age 10 to 19.
Someone that is what?
Age 10 to 19.
Age 10. Is it true that an adolescent is someone within the age of 10 to 19? Is it true?
Yes.
Is it true? Which one is it true? 9 to what? We have different brackets. We have the different age brackets, but basically, the lower limit is always around that time. The upper limit is always around that time.
Another 15, 16. Yes.
Are we together? Are we together? So, adolescent reproductive services focus on addressing unique needs of young people age 10 to 19. Two critical areas of this are very important. In fact, these areas we should look after, we should look into when you are talking about what adolescent reproductive health services. One is what? Drug abuse and what? Adolescents what? Pregnancy what? Education. Adolescents what? Pregnancy what? Education. What's that? Now let's look at drug abuse. Drug abuse and what? Drug abuse, education and what? Even though this one has this has no direct link to what we're discussing, but I just want to talk about it. It has not direct this into, but it also have effects in a way. Am I concluding? But I just want us to talk about it. Drug abuse and education and what? Prevention. So in order to educate the adolescent properly on drug abuse, to end or to stop abusing what? Drugs, we have different what? Programs and interventions. Are we together? That can be put in place, or we are put in place to be able to do what? Curtail the menace of what? Drug what? Abuse. One is substance abuse prevention what? Programs. Substance abuse prevention programs, SAPs. We have the evidence-based program that are focused on teaching resistance skills and harm what? Reduction. Resistance what? Skills and harm what? Reduction. This whole thing also has if you go back to what I said about how how you relate with your children from childhood. It also goes a long way determining what happens at this what adolescence what age. Am I communicating? Yes. If you form a very strong bond with your children, they tell you everything happening in their life. You rarely see them falling into this. They can resist. Maybe as a result of peer pressure, peer group, pressure from their peer group, they can actually do what? Resist them. And if they start thinking in the direction to the direction of getting them, because you notice it. Because one, instead that they inform you about it, what somebody that, hey, do you know that in our class, hey, during break, I went to the backyard, I went to the toilet end to ease myself. I saw our classmate, they were smoking, and they told me to smoke. Me, I refuse. You know, from that story, you may take it up. You may take it up. I may even call the attention of the what? The school what? Authority. You say, so did you smoke it? No, I didn't smoke. No. Why now? No. Well, how you start discussing? He will start telling you why. When after hearing his own point of view, you now educate him well. You may even take it up and okay, let's go to our school. Let me see those people that were smoking that thing. And he'll be proud to show you those people. Am I communicating? From there, you can even save other children that are even that may not even have the type of relationship your children have with you with their own what parents. Am I communicating? Am I with that now? You have actually helped your child or even those children to acquire the skills of resisting such pressure from their peer group. Am I communicating? Am I communicating? Then another one is school-based intervention. School-based intervention. Integrating drug education into very, very important. I don't know. In the school I was teaching before, there was a one program that they started that time. There's a research. It's a kind of research, and at the same time, problem solving. Not just research to publish something, but to actually solve a problem of drug abuse. That program was targeted to the target was to start testing all the students already in school. All the students already in school. Am I completing drug testing? But at the same time, the new fresh men and women as new intake to test them to be sure that they take their blood samples, you test them of any, because most of our youths, most of them are on one drug or the other. Many of them, and that's why you see a lot of defiance, a lot of deviance. Yes, you think it's normal. So such thing can also be introduced in different schools, not just a school doing their own. The schools it should be integrated in the curriculum that just as we do our normal class. This is what we come and talk about. Teach them about substance abuse, the effect, and why they should do stop it or not get involved. Am I communicating? Very important. Then we also look at peer-to-peer education. Peer-to-peer education. Here, the emphasis is on training adolescents to educate peers about substance what abuse what risk. Am I completing? Okay, now just on a micro level, that family, the family, the let's say the woman or the man and the child I talked about, having properly educated the child on the risk of this, that child may even go to school and start to do what, start talking to other people what and what. Am I communicating?
Yes,
Because people, those that man pressure, that man pressure or trying to lure others into that, we are taught by what others, two of us. Sometimes probably they were taught by adults in their streets that are into such drugs. Yes, there are some ghetto streets, you see adults sending small children to buy these things for them. One day they may hide somewhere and test it at that age. Then on testing it now, and they become addicted to it. Now when they are small as they are, when they go to school, they will start recruiting their own group. Am I competing? So if you can have peer pressure, luring others into it, in that same way, proper education against it. Then also through that peer to peer, educate others against what it. Is it clear? That's the point I'm trying to make. Any question?
What I also want to ask.
Okay.
Like teaching all these children about substance abuse.
Yes.
I mean, it's just now.
Yes.
Those children, they want to really try it. Even just try what is inside the substance and see how it is.
Yes.
So I think they can even go into taking all those substance, not substance.
Okay, you mean
Because when we say all this, like remember, there was a time we were teaching us all this contraceptives. So after the class, we went to the pharmacy to get a bottle. I will just open it to see how it looks like. You understand? I think from there, people can also go into that. I don't think they just practice this thing and see
What they
how it
thought
looks
of
like. You understand? You can practicalize it.
yes, I understand. Hello. He asked a very, thank you very much for that question. I like the question she asked. See, there's nothing you will do to totally eradicate drug abuse. Totally is not possible. Am I communicating? Good. But what you are doing, it is still better to educate them. So those that want to mess their life up should continue. But the right thing is to educate them against it. That is the best thing to do. In this situation now, it's better you tell them about it than not. Because take the leave it. What can I even say itself? Let's even move away from. Okay, let's continue because this is health education about what drug abuse. Let me not go far. See, those days it was a higher institution alone. We had this, but now secondary schools, even primary schools. So as they are going down, you have no choice again than to take that education down to that level. Yes. On the normal, on the normal circumstance, it's supposed to be, hello, I want together. It's supposed to be age. It's supposed to be age. Age what? What does about when we are talking about? There's also if there's this information that you give to a particular age. Age appropriate under normal circumstances, that's what it's supposed to be. But now, since they have started recruiting primary school pupil, you have no choice than to take it down to that level. You don't miss word again. You have to say it openly, and you start from the how they can how they are lured into that. Majority of them start from these big boys in the streets sending them. Some even see them. Some even learn it from their parents. Such ladies. Some even taking these drugs from their parents. They see them. Some parents may think that they are hiding and be doing it, but they know they see them. What are we? The lot of things parents are doing. Hello, there are a lot of things parents are doing, but they don't know that their children are aware that they are doing that. So we can even buy. Let them even go to porn. They will buy porn and go and keep it and watch it. They know where you hide it. They see it, but you wouldn't even know. They know where you are hiding all those things you are watching, but you may not know. And getting them exposed at that age is not a good thing for them. Am I communicating? Because that is not a proper education. But if they're educated in the right way about it, there's no problem. But hiding it somewhere and they will go and take it out and watch, it's not a good, it's not a proper education. Because that thing you're hiding, they have seen it and they know where you're hiding it. You buy Igbo, you after taking you go you hide somewhere. They see, they know when you are out. They will continue from where you stopped. They will continue from where you do what? Stopped. After watching, the other one will tell the other one, and let us do that thing they do in that film. Mommy and daddy are watching. Am I communicating? Yeah, maybe that thing they do in that thing. So the point I'm making is this. The point I'm making is this. They are not, see, in the world today, they are not like this. They are supposed to no. Talk about it, but there's how you talk about it, not in the how you. Are we together? We're making noise. Hello. Are we together? Are we sure? Please, can someone help me with? I don't know where this one is again. Help with their phone. No, I mean the. Okay, Richard, please help me. I forgot. No, I mean the. Are we together? Please, it's important we educate our children properly. Do it yourself. Don't leave them at the mercy of their peer group or the mercy of the streets. When you fail to train your children, the street will train them for you. By then you start complaining. Are we together? Yes. So let's look at family-based interventions. Family-based interventions. Here, look at we look for a way to strengthen the words. I think I've been talking about this since. I've been talking about this since from the beginning of this lecture. We look for a way to do what? Strengthen the parent-child relationship. Parent-child relationship to prevent substance abuse. Everything starts from your relationship with your children. See, to be sincere with you, If you see any, if you see any child or any adult that is misbehaving, trace the training from the tender age. You rarely, it's rare, greater percentage. If you trace their home training, there was a problem there. Am I competing? Listen, see, there's something you don't understand. Is garbage in what? They're not like children of this day. It's the same thing. Is garbage in, garbage out. The same person saying children of these days. If you look at how he was handling that child when he was young, when he was maybe 1, 2, 3, 4, then you understand that it also has a lot to do with how from that. Now they'll tell you, see, this saying, how did that they even say self? They said this spare the rod and do what again? See, you see that statement. It's not today. It's an age-long what statement, and the computer age, jet age can never change it. I'm not saying you should go and kill your child. It's not what I'm talking about. The point is that instill discipline in your children from tender age. They're nothing like it's too young, it's too small. No, instill what? Discipline. Am I competing? Instill that discipline. It's very important. It is very important. It may not necessarily be that you go and get one big cane and start flogging anyhow. You see that cane, keep it. It's important. Do you know why? If you there are something they won't understand by just mere words at that age. And as they are talking, you're just wasting your time. Am I communicating? There's age your child will get to. It's not cane again that you need. It's words. Am I communicating? Yes. But as age, the baby will be. Not that you be flogging all the time, but that cane alone means a lot. You like anything you are saying, they won't understand what you are saying. It's not them you are talking to. Until you raise it, they'll keep quiet. Am I communicating? You combine the two of them. You combine the two of them. See, if you don't train your child well, forget it. Train your child in a way that you do what? Because you will not do what? Depart from it. Yes, we may drift due to what our environment or the other, but the person will always remember where he's coming from. A point we reach, he will be like, it seems I am going what? Astray, because he or she is started from where? Somewhere. He's fully aware of where he came from. Am I confused? Good. But if there was nothing like that at all from childhood, there was no point of reference. There was no point of what? Reference at all. You will just zoom like that, and that's all. So that's why I said that if you the greater percentage of people messing around here, trace the home they came from. There was a very serious problem there. Some may not want to accept it. There's a very serious problem there. Majority of them. As I have now, there's some things I want to do. I remember where I came from, how my mom trained me. There's things I want to do now. I remember it because my dad died at a very tender age. I remember what I'll just put myself together. Even though she's not here again, she's late, but still, all those things I still remember it in my mind till today. Till today, you go to school. As at that time, you go to school, they will give you, they will tell you to buy, that you are going to buy a size book, or you buy, you bring money for so thing. Then you come back, it's nothing. You play after eating, you sleep off. Then tomorrow morning, you now come and say, "Mommy," and they told us to, "Hey, God, that day, what you see that day, you be like, what did I do to this woman? Am I committing?" You be like, what is wrong with you? And since that training is still in me till today, it helped me to be proactive. You don't do things just anyhow. Before you do things, plan it, think about it, prepare for tomorrow. Am I communicating?
Yes.
The training did not come directly as preparing for tomorrow, but it helped me to know that if you want to do something tomorrow, start now. Start work now. Even it tells me even academically self. Am I communicating? Then you go outside and fight. You go outside and fight. If you win the fight and come back home, the beating will just single beating. The beating will be single beating. At least you will use the you have victory outside and be controlling yourself. But if you go outside and they beat you well, then you come home hoping that she will now go and beat them for you. She will deal with you. She will tell you, don't fight with anybody outside. If anybody does something to you, come back home and let me know. Let me know. Simple. And any day you do that, you see her in action. Am I communicating? Make sure you did not cause trouble with anybody. Make sure you avoid it. But if somebody lays his or her hands on you, come home, let me know. And it helped me to avoid troubles. They're nothing like throughout my going on, they're not like I'm fighting. Fighting for what? After fighting, I'll go home, they will beat me again. No need. Am I communicating? So that the last one I can never forget in my life today. The day I don't know what I was doing. You know that children will always be children. I don't know what we were doing. And I mistakenly, one guy like that, he beat me. I started fighting him. You beat me today. You beat me today. I heard the guy. The guy was beating me anyhow. Beating me anyhow. All the others were there laughing at me. I heard the guy was beating me. After beating me, the guy dead to me that day. Have you ever fought? You were expecting people around you to come and support you. Nobody was there to help me. My last hope was my mom. The person I put all my hope in that helped me. What she did to me that day. What she did to me that day. What she did to me that day. Till today, everything that happened is still clear in my eyes. Still clear, like as if it's happening now. So what point am I making? It's all about what? Home training. I don't know what is going outside fighting. They just fighting for what? There's no room for that. No room for that at all. So it's very, very important we develop that. Okay, sorry, let me open it. We develop that what? In as much as you are training your child, please don't push them away from you. Still bring them what? Close. There's this saying. I don't know how they say it in your language. in Igbo language, they say that, okay, let me just use English, that if you use left hand to beat a child, then you use right hand to do what? Is it lefty to do it again? Anyone to beat, then you now you use the hand to bring the child close. Then after pacifying that, that's child, do you know why I beat you? You say yes. Why? Because I did this, I did that, I did this, I did that. Is it good? No, mommy, no, daddy. Okay, what's your plan now? Do you want to do it again? No. Why? Hey, daddy, you deal with me. Okay, don't do it again. No. He's happy. Tomorrow, anytime you want to do that nonsense, remember what? And if you beat again, you beat him again and bring him close again. Keep beating and bring him close. Keep doing it. It will become part of him. Am I competing? Not to chase him or her what away, because if you don't bring him close, you will not be able to do what? Help them acquire this what? Knowledge. Are we together? So next one is what? Counseling and what? Therapy. Counseling and what? Therapy. Sometimes it will get to a point you will involve what? Therapists. Two of us, yes. Very important. This issue of therapists that is not common in this part of the world. It's common there. Do you know why it's not common in this part of the world? Because our religious leaders, pastors, are you aware that they do this work for us? Are you aware? Some of our pastors do all these things, all this therapy, all this without even knowing. Are you aware?
Yes.
Are you aware? Yes. You may go to see them. What was supposed to be a spiritual, this thing may turn into what? Psycho what? Am I competing? Yes. Some may even go into social what? Go into economic, trying to see a way to help you. Because here, we are religious here. On a more serious note, I like see, you see this our being a very religious environment. I like it. In as much as we are not trying on the aspect of trying to, see how we can transform all those things to economic gain. Am I competing? That will benefit everybody. But basically, it's helping us in a way. It has its own what? Advantages. There are some things that cannot fly in this part of the world. True of us. There's some things that cannot fly, as in that cannot prevail here because of our what? Religious what? Beliefs and mindset. Am I communicating? That's why there are some things that cannot just be legalized here like that. If you want to do it, the people will turn against you. Am I communicating? There are a lot of them that you cannot just do what? Legalize here. Unlike what you see in other part of the world. So everything has its own what? Advantage. But the only area I'm not comfortable with is that we are here to transform it to a what? Economic what? Gain. You may have churches doing people coming there to pray, wonderful. But you that is the owner of you that is in charge of the church, what are you doing to empower your what? People economically? Am I communicating? What are you doing? That's the only area I'm not comfortable with. I want our religious leader to do more. What are you doing to empower them what? Economically? That is the only area. But any other one is actually what? Helpful. They're helping us. Do you know? So do you know? If not for the trust, the belief they put in us every Sunday or every Friday for for those that go to mosque, then Sunday for those that go to church. All those words of encouragement, sermon they preach, there's hope. It gives us hope. If not, even if what I say, do you know the level of mad people you see on the road? And level of suicide you will see. You cannot describe it. Level of suicide you will see, you cannot describe. What I do. You're not in my class.
No.
Ajoke, what are you doing?
Sir, not doing anything.
There's a time you look as if the world is coming to an end. But if you go to your pastor, he talk to you, do this, do that, calm down. God is in control. God is in charge. God is there. You go back, fulfill. Even if that thing has not happened, that this relief you have. True of us, yes. So if those things are not there, I wonder how the society will look like. So counseling, maybe that's why these things are not that common here. Do you know where this counseling of a thing? Do you know where you see them more? Society that have stopped going to church. Quote me anywhere. Society where people stop going to, don't believe in what? Not just church, religion entirely, totally. Even here, where you see the most. Yes. But wait. Hello. Who knows? Who has somebody that stays outside, that stays in the Western world that actually discuss about this issue? It's a big time job there. Yes. Therapist. Do you know why? You don't need it again. By the time you sit down in your church or whatever religious or group you belong to, by the time you go there once a week and sit down and listen to leaders speak to you, there is fulfillment you get. Even if you are on the verge of giving up, hope will what? Restore. Because do you know why? We see ourselves that we don't need it. Yes, even though we need it, but we see ourselves that we don't do what? Need it, because be like, what am I? Indirectly, by going there and coming back, you go there and come back different person. I don't know if it happens to you. Instead I go to church and come back as a different person. There's something new I learn about life. There's something I'm fulfilled. My heart may be heavy with something, but once I go there, pray, listen to sermon, I go back relieved. So somebody in that situation, and you start telling person about what? Therapist, you be like, is it for free? You say you pay. You say no, I don't need it, because you see no need for it again. Two of us. Are we together? So counseling and what? Therapy. When all these things, when you failed to do the right thing in terms of their work training, and they start messing around, you may get to a point they need what? They need what? Therapist. Am I communicating? A professional that will now handle them professionally, because a professional is always a what? Professional. Take it or leave it. A professional is always a what? a professional. What's time? We agree to do 2 to 3 hours, eh? Yes, we agree, right? Yes. Huh? You go far. Treasure. How many hours? 1 hour. This afternoon lecture doesn't work at all. But we have no choice. We have to do it. Sorry about that. Sorry about that. We have no choice. I want to see where. Let's see if we can cover this before you are missing next exam. She is good like that. She is good like that. She is good. Eh? So we should stop now. Okay. If you want us to stop now, raise your hand. Majority will carry the vote. If you want us to stop this class now, raise your hand. Raise one hand. One hand. Leave her now. Leave her alone. Oh yeah, let me count. I will not count this, so it's only what I'll count. If you raise 2 hands, cancel. Hey. Okay. If you want us to continue, raise your hand. What's going on here? Seriously, I wish we could just try.